Confused? If you're worried about someone who has had a head injury, you should get medical advice. With someone who has had a severe head injury, you may find that they have had a severe blow to the head, unresponsiveness or a deteriorating level of response, leakage of blood or watery fluid from the ear or nose, unequal pupil size. If a casualty has any of the signs of a severe head injury, seek emergency medical help. To treat someone with a minor head injury, sit them down and give them something cold to hold against the injury, like an ice pack or frozen vegetables wrapped in a cloth. Amy, can you just put the injury? Thank you so much. Assess the level of response using the AVPU scale. Ask yourself, A, is the casualty alert? Are the eyes open? Do they respond appropriately to commands? V, does the casualty respond to your voice? Can she answer simple questions? P, does the casualty only respond to pain? If you pinch the earlobe, do they open their eyes? U, are they unresponsive to any of the above? If they can respond normally, the head injury is probably minor. Keep monitoring their level of response, breathing, and watch for any changes. Treat any scalp wounds like a bleed by applying direct pressure to the wound. When the casualty has recovered, ask a responsible person to monitor and look after them. If a casualty has sustained an injury to the head while playing sports, do not allow them to return to the sport until they have been fully assessed by a medical practitioner. Advise them to seek medical advice if their condition gets worse, they're over 65, they've had previous brain surgery, they're taking anti-clotting medication, they've been drinking or taking drugs, or if there's no responsible person to look after them. If you check their level of response and they're not alert, and so you think that they've had a severe head injury, call 999 or 112 for emergency help and tell them that you suspect a head injury. If you can, use a speakerphone so that you can continue to treat the casualty whilst making the call for help. If they're unresponsive but breathing normally, following a head injury, open the airway in the position that they were found, just in case they have sustained a spinal injury as well. This is to reduce further movements to the neck. Call 999 or 112 for emergency help. Continue to monitor the levels of response while waiting for help to arrive. If you think someone with a minor head injury is getting worse, they may show these signs: increased drowsiness, persistent headache, confusion, dizziness, difficulty walking, difficulty speaking, vomiting, double vision, seizures. If you're concerned, call 999 or 112 for emergency help and monitor their level of response. So remember, when treating a minor head injury, sit them down, treat any scalp wounds, and check their level of response. If they have a severe head injury, call 999 or 112 for emergency help. And that's how we treat someone with a head injury. If this video has been helpful to you, help support St. John Ambulance by going to sja.org.uk/donate.
Their little fingers and hands can easily get stuck in small spaces. Sometimes they may get hand or finger injuries such as bruises, cuts or fractures, or they may hurt or sprain their arm or wrist. In the following steps we'll cover hand and finger injuries, then we'll cover forearm and wrist injuries. If your baby has trapped their hands or fingers, these are the things to look for. They may find it hard to move their hand or wrist. They may feel pain in the area. The hand or wrist may be tender and there may be swelling or bruising. If you think your baby has a hand or finger injury, take the following steps. Sit or lie your baby down and try to raise and support the affected wrist and hand. If there is any bleeding, run the cut under cold water first, then loosely cover the wound with a new sterile dressing or large, clean, non-fluffy pad. Call your doctor or see a nurse, especially if your baby's fingernail has been injured or you think there may be a fracture, a